Alright guys, so we are trying to look at aminoglycosides, antibiotic drugs. Okay, aminoglycosides as a type of what? Antibiotic drugs. So when you're talking about antibiotic drugs, basically you are talking about drugs that can be used in treating what? Bacterial infections, bacterial diseases. So aminoglycosides actually happen to be an example of drugs that could help us do this. So what we are looking at is their pharmacology. So we get to talk about a lot of things about these aminoglycosides. So first of all, you should know that aminoglycosides are actually what? A broad spectrum of drugs. So when you say broad spectrum of drugs, that means what? They can act on many bacteria, right? So they are bactericidal what? Antibiotics. They are commonly prescribed for children, primarily used for infections that are usually caused by gram-negative pathogens, right? So your mind now heads back to the when we're talking about gram-negative bacteria. Okay. So examples of these aminoglycosides, you have drugs like what? Gentamicin, Amikacin, Tobramycin, Neomycin, Streptomycin. Well, I've spoken about their pharmacology. Oh, funny enough, it's not that I just coming to now talk about a single lecture that covers all of them. You understand? So these are a group of natural and semi-synthetic antibiotics. Like for example, they have a suffix mycin, shows that they actually were derived from some natural stuff. So they consist of a polybasic amino groups linked to two or more what? Amino sugars, right? So streptidine, okay, 2-deoxystreptamine, okay, garosamide, okay, and this is usually linked through what? A glycosidic linkage. You understand? So streptomycin was isolated from what? Streptomyces griseus. Aminoglycosides, they actually share some common properties. Okay, so they are high water soluble, they are stable solutions when they actually what? Dissolve. They have no oral bioavailability. Okay, they are excreted unchanged in urine. Bactericidal, that means they basically pause the activities of a bacteria. They don't really bactericidal is they kill the bacteria. It's bacteriostatic, that is pausing the activities, right? Okay, so moving forward, you said that they are high concentration, they accumulate in renal cortex and endolymph of inner ear. So they are usually what? They can be toxic to your kidneys, they can be toxic to your ear. Cross resistance among group is low. Bactericidal action is what? Concentration dependent. Alright? So they penetrate most bodily fluids, but they don't penetrate what? Cerebrospinal fluid. So you can't be using them to treat what? Infections in the brain. Do you understand? So examples, we have already listed all the examples. Amikacin, Tobramycin, Neomycin, Streptomycin, Gentamicin. Alright, so these are all the examples of organisms that they can actually be effective on. Please pause this video and write this down. Okay, so what's the mechanism of action? They bind to the 30S ribosome subunit. So this will now inhibit what? Making of protein. That's protein synthesis. So when you inhibit making of protein is needed for the organisms to stay alive. You stop protein formation, you kill the organism. You get? So interference with the initiation complex of peptide formation, this is how they inhibit protein synthesis. They also cause misreading of mRNA. This will now lead to what? Incorporation of incorrect amino acids into the peptide. They cause breakup of polysomes and disaggregation into what? Non-functional monosomes. Therapeutic indications, right? Used in treating what? Aerobic gram-negative bacteria, like infections from aerobic gram-negative bacteria and some gram-positive bacteria. E. coli, Klebsiella pneumonia, Pseudomonas aeruginosa, Enterobacter species in general. Okay. So what next? Okay. Well, this one is just trying to talk about like therapeutic uses. Okay, doses. Okay, But if you need this, you can pause and look at it. So mechanism of action is this. So sometimes the cell membrane can become inactivated. That's how the organisms try to survive even when you give this drug. So principal mechanism of resistance to aminoglycoside occurs by phosphorylation, adenylation, and acetylation. So the enzymes are acquired mainly by conjugation and plasmid transfer, mutation and deletion, okay, on 30S ribosomal subunit. Of course, if you mutate the 30S, they will not have a place to bind. Do you understand? So side effects is what we spoke about. Ototoxicity, they accumulate in the ear. There's an endolymph. They also accumulate in the renal cortex, causing some toxicity to the kidneys. That's nephrotoxicity. Okay. Hypersensitivity, neuromuscular blockage. All these things are rare, but you can actually pause to look at them. Okay. So I think that was it for aminoglycosides, having an overall lecture on them.